This is the Asian female cadaver. She died at age 26. She had gastric cancer. She had facial reconstructive surgery. But she also is the one that was either she was pregnant or they made it so that she was pregnant. I don't know. So it's one of the fetus. Yep. We'll go up here. What am I doing? I clicked on one. Hello. Loading something. Not sure what. Hard to do this with a touch screen a little bit sometimes. Anyway, she had a baby, and the baby is a boy, and obviously she's female. So one of the things they do is they have her stuff in pink and his stuff in blue, because you can see both the heart rates, for example, and watch because you don't have the same heart rate as the baby inside of you. And you can speed it up and slow it down, and I'm not sure why you would do that, but if the baby's heart rate is too elevated, that's one of the things that indicates there could be something wrong. And they don't want it to go, if it's too high, they'll take the baby or do a C-section or something. And I have no idea if they did a C-section. I, have no clue, because they don't tell you any of that stuff. I also don't know if the baby died. Did they just take pictures? Because the baby looks like it's full term, which is kind of weird. Yeah, it would be kind of horrible. And certainly things happen, babies can die, but not very many parents would donate the body to science. You guys done? Yeah. And she wants her no party. Did it come up? Oh, it's the brain. Well, I suppose if you guys in AMP1, you can see all the cranial nerves here. Okay, I think it names them. What name them if I touch on them?
Nerve.
Facial nerve.
Cerebellum.
There's the cerebellum.
Accessory nerve.
The accessory nerve. You guys know what that one is? Will it name that part right there? The optic nerve. Okay, because this head is facing you, I believe. Pituitary gland in there.
Body.
Mammillary bodies. I could get it.
We could just remove the brain.
Yeah. Here it is on the side view, so you can, the eyes would be on the, I guess, on the bottom of the screen for you guys at home, what you're looking at. You'll see the
cerebellum
back there, and then I turn this back over, this down here is the brainstem.
Spinal cord.
Okay, the spinal cord.
Medulla
the next part
oblongata.
Up is the medulla oblongata. What's the part above that? You guys remember? This part?
Pons.
Pons, right? That's one that does breathing. And above that is the midbrain. I don't know if I can click on that pituitary gland back there. Mammillary bodies. Just let me click that.
Anterior pituitary.
There's the anterior pituitary. If I color that white, can you see it better? You guys at home, I try to make this brain bigger. It's a really good picture of the brain. I mean, it's really good images. You can see all these parts.
Olfactory nerve.
Olfactory bulb. Remember the bulbs sit in the cribriform plate? Remember the little holes in the cribriform plate? That's what allows the smells or the chemicals to come up and trigger the olfactory bulb. You can see the grooves, the bigger
Frontal
fissures,
lobe.
and then these little grooves are the sulci, and the bumps are called gyruses. I wonder what that is. It looks like there's a
Occipital lobe.
lesion on the back of her brain or something right there.
Temporal lobe.
Maybe it's just a shiny part. I don't know. But
Occipital
doesn't it
lobe.
look like there's something growing there?
Well, it's like a pimple.
Yeah, it looks like a zit. That's exactly what it looks like. All right. So let's I get rid of this. I think I exit this one. No, I don't want to exit application.
Can you just hit home?
That's where I hit. At the top, where it is, there's the fetus. Let's open that one. And see what we can see with the baby. So you guys all ready to be finished with this class? Alexis is in AMP2. The last section of AMP2 is reproduction and pregnancy. And the last section of AMP1 is the nervous system. It takes a while for these things to come up. So here's a fetus. And you can see the muscles already, you know, and if you click on them, I don't know if it
Biceps
tells you.
brachii muscle.
Yep, it does tell you. Biceps brachii. Sometimes the smaller ones, they don't show them all. You can notice the bones, though, like in the brain here. This
Temporalis
bone
muscle.
and this bone
Occipitofrontalis
have
muscle.
not quite fused because it's still hyaline cartilage. And that's good because then the head can fit through the pelvic canal during birth, which is why some babies are born with their heads all funky shaped because it was quite the squeeze to get through there. Okay, if I turn him over, okay, you can see every bone in the hands there. Carpals, metacarpals. You can see pectoralis major muscle pretty well there. Notice the umbilical cord.
Umbilical vein.
Okay, the vein and the artery obviously attached. You can see testes. So this is a little boy. You can see that pretty well. So like I said, the baby it's got to be close to term.
Yeah.
You know. Anyway, you can see. You guys remember what the big muscle is on the back? Or this one right here?
One of them's the trapezius.
Yep, this one's the trapezius. And this is latissimus dorsi. Again, you can see the hyaline cartilage hasn't formed completely to bone yet. Okay. That doesn't happen until after you're born, actually. So babies are a little bit like rubber. Not that you should bounce them, but they definitely have more flexibility than we do because their bones haven't fused. You can also take away the skin and the muscles. You can see.
This looks creepy.
Yeah, that looks a little creepier. The eyeballs especially. You can see the intestines there. The kidney, the spleen. So you can see all the parts are there. The bones are very white at the end because, again, it's mostly hyaline cartilage. It hasn't fused completely to bone or hasn't ossified. So, again, a little bit more flexible and rubbery. See the lungs in there.
Posterior intercostal artery.
If we get rid of, I wonder if I can do that. I can get rid of ribs. Get rid of the rib cage. There you go. Now you can see the lungs a little bit better. Okay?
Posterior
And the lungs
intercostal artery.
are, get rid of those. The lungs, of course, are not exchanging gases because they're filled with fluid, amniotic fluid. That has to change once you're born, obviously, but they still get blood flow to them because they're growing and developing.
Lung.
But they're not going to look quite like they would once he starts breathing air rather than having filled with amniotic fluid. So that's why you try to get the kid to cough or scream that first time. That helps get rid of some of that liquid and close the hole in the heart and that type of thing. We pull him over. I am going to get rid of his arms because obviously he's not in anatomical position. But if we get rid of his arms, you can see.
Are you all done?
Yep, the last two just finished.
Okay.
All the stuff's right there. So you can see the heart.
Pericardium.
Okay, the pericardium is, remember? Pericardium is, you guys remember what pericardium is? Membrane around the heart. And if it's the visceral pericardium, it's touching the heart. If it's the parietal pericardium, it's lining the heart cavity. Okay? Anyway,
Middle
then
cardiac
there's a
vein.
bunch of fat
Epicardium
around
fat.
the heart, and that's completely normal. If you take that away, you can see the muscle wall
Ventricle.
of the heart. So there's his ventricle. You can see lots of arteries and
Middle
veins
cardiac
going on
vein.
here.
Ulnar veins. Basilar vein.
Still have all
Ulnar
the arm
artery.
veins there.
Posterior
his arms were
intercostal
there.
vein.
You know, see the atria,
Atrium.
right atrium. I color that white.
Internal
Color the
thoracic vein.
right
Ventricle.
ventricle, make it blue.
Auricle.
Right auricle.
Ventricle.
Left auricle, left ventricle. Let's make that one purple. You can see it's kind of tipped. You know, if the baby was tipped up, the heart's almost sideways in him right now, almost completely. So there's a picture of the fetus, which is kind of cool. You can see the fontanelles and the head hasn't, the bones haven't fused yet. That's kind of cool. All right. So if we look back at her, take off some skin. There's her muscles. You guys remember all the muscles? Okay. What are the muscles on the front of the leg? That's a question on the AMP2 final and on the AMP1 final. Quads or hamstrings are on the front?
Quads. Hamstrings around the back.
Hamstrings are on the back, quads are on the front. Good. Ariel is here in person for the 4 of you guys who are at home. So I have somebody here and 4 people at home. All right, let's take a little bit more off. Okay, we get most of the muscles gone. And you can see the layer of that fat. Remember, that's the greater omentum.
Greater omentum.
And if you remove the greater omentum, now you can see the gut organs a little bit better. That is the abdominal cavity from the diaphragm down, or abdominal pelvic. And it is lined with the peritoneum. Again, visceral touches organs, parietal peritoneum lines the cavity. If we take out some of this
Mesentery.
fat here, the mesentery, then you can see even more of her digestive organs, and that's her fistula right there.
GI. Fistula.
That white part. Here's her stomach
Stomach.
in red, and her jejunum
Jejunum.
in blue, and her stomach is attached by that fistula to the jejunum, and it should not be. That is not normal. Okay, get rid of this ligament
Falciform
here,
ligament.
so you can see that a little bit better.
Round ligament.
just kind of just holding stuff. You can see her liver. Okay, the liver is her largest internal organ. What quadrant would it mostly be located in? What quadrant? That's a good review question.
Upper right.
Upper right quadrant. And her lower right quadrant is
Vermiform
where the
appendix.
appendix is. Okay, color that purple so you guys at home can see that a little bit better. So the liver is in the upper right and the appendix is in the lower right. Okay, remember the quadrants only divide the abdominal pelvic cavity. It does not include the thoracic cavity where your heart and lungs are. Your diaphragm is the upper limit of the quadrant placement. Okay. You guys okay so far? All right. This is the very last one, so I will be glad to answer any particular questions. Otherwise, I'll just keep talking because I don't know what you guys would like to hear necessarily. The body directional terms, you are seeing her in anatomical position, but we could cut her sagittally. Okay? Sagittally cuts you into sides, and when you do that, you can see the internal organs. So an MRI, a sagittal MRI, could be done at any place. This is mid-sagittal, and you can see her vertebra, very nice. And one of the things you can see is the vertebral discs, and she has pretty good ones until you get up here. And then it looks like there's one that's messed up, her second thoracic vertebra. I don't know if she was, maybe it was the whiplash or other things because she has facial reconstructive surgery. She had screws in her head. So you wonder if she was in some sort of accident.
She was probably in a car accident because with whiplash it affects like your lower on the bottom.
Yeah. So likely there was some damage there. You wonder. I mean, it looks like there's a bulge right there pressing on her whatever the esophagus or nerves or whatever. You'd think that she might have been in pain from that. Okay, you can also see the heart cavities. You can see the valves closing, okay, right there, which is kind of cool to see in the right ventricle. Remember the valve there is going to be the tricuspid between the right ventricle and right atria. Okay, so obviously doctors, when they do MRIs, if they wanted to look at her fistula, they would want to do an MRI from all three directions in that location to kind of get an idea of where it might be. So sagittal is one cut where you can see sides. Now if you do, we put her back, to full size, and then we cut her front to back. Okay, now this is a frontal cut, so it cuts you into fronts and backs, and we just cut the front half of her off. Okay, so that's the back part of her liver, the most posterior part. Again, a different angle you can see in the heart. You can see this is the left ventricle. Because the right ventricle is, the heart is tipped, so the right ventricle is kind of the top when you're looking down at somebody's chest. You can see how thick the wall is of the left ventricle. Remember, the left ventricle pumps blood to the whole body, so it's much thicker and stronger than the right ventricle, which we've taken off at this point. It's above the table. You kind of got to get yourself oriented when you look at the when you look at the cadavers from different views. And I'm not great spatially, so sometimes I get all turned around. But you can see her jejunum, and you can see the inside there, and it looks perfectly normal, Otherwise, there's a connection there that shouldn't happen, the fistula, but otherwise her jejunum is still doing its job. She actually died of pneumonia, which is pretty common with cancer. Chemotherapy makes your immune system pretty much shot, and often you're laying there, you're not moving around. Pneumonia is very easy to catch, especially in hospitals, and that is actually what killed her. And you can see her lungs
Inferior pulmonary
are
vein.
pretty bloody and full of fluid, which is literally the definition of pneumonia. Okay, so if I do the other cut, the other one, of course, is transverse and cuts you into tops and bottoms. In this case, they cut off her legs, so we're not going to be able to see very much, but if you tip her up, you can see the inside of her femurs. Okay, right here. Tip her up a little bit, make that bigger. Remember that the long bones, the shaft of the bone is called the diaphysis. Remember that from the bone chapter? And compact bone is the main type of bone in the diaphysis, and the bones are filled with yellow marrow in the shaft, in the medullary cavity. It looks a little red there because you can see blood vessels. And it's the spongy bones at the end of the epiphyses where the red marrow is. Red marrow is where blood cells are made. The yellow marrow could actually take over for that if there's some damage, but generally the yellow marrow is just a highly nutrient source of rich amount of nutrients, which is why dogs will chew and chew and chew to get to that, because it's apparently full of good nutrients. Okay, so we're going to put her back together and put her back in anatomical position, basically. And instead of cutting the transverse cut down at the legs, we're going to cut right through that fistula. So that's the clipping tool right here. And we're going to make a line. Whoops. It didn't let me do that here. Just a second. Let me put her back into anatomical position. Then make sure the clipping tool is checked. So if I draw a line right through this, and whichever side I touch, it's going to disappear. So I'm going to touch the bottom, and it went away, and now we're going to tip her up. And so this is where an MRI might be important if you were looking at that fistula. And you can see we cut through her kidneys, we cut through her spinal cord, but we also cut through that fistula right there. You can see some of the jejunum there. Okay. We cut through her colon on this side and on this side,
colon.
so the ascending and the descending colon.
Anterior, inferior, pancreatic duodenal
There's the
vein.
inferior pancreatic, so we cut through some of the pancreas as well. And I don't know necessarily how to diagnose. I'm not that kind of doctor. But hopefully your gastroenterologist will be able to look at that and see that the colon looks pretty normal. The inside of the jejunum looks pretty normal. You know, what's the deal with
GI fistula.
with the fistula? And again, it looks like a normal colon, but it's just located in a. You're not supposed to have that. So you're not supposed to have a fistula. All right, let us undo. Okay, let's put her back. All right, so we're going to bring her down a little bit, and I'm going to expand her head. And you can see some of the dark blue dots underneath her eyes and above her eyes. Those are screws for her facial reconstructive surgery. I think if I take off a little bit more, you might be able to see it a little bit better. Again, the eyeballs move, so it's a little bit creepy. But you can see that those blue areas where those little screws were when she had that done. And it must have been successful because she looked perfectly normal. I mean, it must have healed. So I'm assuming it happened years before her body became a cadaver, because it would take a while for all that swelling to go down and the skin to heal and the bones to heal. And everything. So I'm assuming it had to be at least a couple of years before she didn't even have any scars on her face. You know, somebody must have done a pretty good job with the plastic surgery to make her look pretty good. You know, when I put her back together, go back together. I mean, her face, you can barely see any scars on it. You know, they did a good job. All right, so let's take her back down. Okay. There we go. We're back to where her eyeballs are showing. Oh, that takes some of her eyeballs right out. You can see her eye sockets must have had to been reconstructed there. She must have really smashed her face when she was in the, like you said, probably a car accident. Car accidents are fairly common in the United States. Okay, and last thing we can go over again is reproduction. Notice that this is her
Urinary
bladder.
bladder.
I'll color that purple. Her uterus is
Broad
on
ligament.
top of it. Okay, the uterus is on
Broad
top,
ligament.
which is
Uterus.
why when you're pregnant, when that little kid is bouncing up and down, it feels like you got to pee all the time. Okay. Anyway, if you expand this, you can see from each uterus, this is the ovary up
Ovary.
here. You see that? I color them red.
Ovary.
Okay. And the
Ovary.
tube that goes up to the ovary, of course, is the fallopian tube.
Fallopian tube.
Or uterine tube. If I color those white, maybe you can see those.
Fallopian tube.
You see those parts at home? Okay. So from the uterine tube goes up, and the part at the top is wider. It actually fits over top of the ovary, and when the ovary releases the secondary oocyte, it kind of pulls it or sucks it in there, and it starts to travel down the fallopian tube. And fertilization, of course, takes place, or is supposed to take place, in the fallopian tube. Okay, so it takes about 6 days for the fertilized egg to get down there and into the uterus, and then implantation must occur. And implantation fails a lot, but if you don't get a good connection, you don't get a placenta and umbilical cord and all of that formed, and you would never be able to maintain a pregnancy or have a viable pregnancy. So implantation is pretty darn important. And if it doesn't happen, then a woman would menstruate as normal 2 weeks, after ovulation, and you might never have known you were pregnant. Although pregnancy tests can now pick up enough human chorionic gonadotropin 9 days after you're pregnant, and implantation fails and you lose the baby at 14 days, and people think we have more miscarriages. We don't. We just know we're pregnant earlier than we ever did before because of the pregnancy test. But without good implantation, you're not going to be able to have a good pregnancy. So you want that to work. So if it doesn't, the uterus loses its endometrium, the lining, just like normal. All right, you guys have any questions or want me to go over anything else? You're just happy the class is almost done? You guys been working really hard, double time all summer? If some of you are taking AMP2 in the fall, if you're taking it in regular time, it's going to seem very slow to you compared to what you've done this summer. However, it's probably a little easier to take it slow because AMP2 there's a lot of work in AMP2. It's tough. And I'm assuming some of you guys at AMP2 are going into the nursing program. Maybe some of you are starting this fall. And not that I know what you look like, but maybe I'll see you on campus or you'll see me.
Oh, when I'm done with AMP2, I will continuously come say hi and harass you. So.
Oh, okay, there we go. And I don't always, I don't know, because I have so many students online, except for you, Ariel, I don't know what anybody looks like. Your little, little avatars are all I got. Okay, I'm going to stop the